We can begin this hour with the legacy of COVID. We're talking about both the loss of life, also the lockdowns, and how it could influence the midterm elections. And we focused in on the state of Florida, which on the one hand had the 12th highest death rate in the country. 382 fatalities for every 100,000 people, according to the CDC. That is more than other big states like California and New York. But at the same time, Governor Ron DeSantis says he was right to reopen the state's economy and remove restrictions long before many of his more cautious peers. So now voters get to decide which approach they want to reward, the one in Florida and also beyond. For a moment in early 2020, every governor in America seemed to be saying the same thing.
We don't want large crowds of people congregating right now.
Practice physical distancing.
To fight a deadly new virus, we all needed to stay home.
You should not congregate in crowds.
But an effort to keep the public safe also meant shutting down schools and squeezing people's ability to make a living. People like Eddie Morris, owner of infamous fitness studio in Hialeah, Florida.
It was horrible because you're counting in your bank account, thinking, can I make this next payment or am I going to close down? What's going to happen to my facility?
Reopen Florida!
As frustration mounted, blue state governors stayed cautious, committed to following federal guidance, while Republicans, like Governor Ron DeSantis, went on to defy it.
People know that Florida is a free state. They're not going to be shut down. They're not going to have restrictions.
Lifting stay-at-home orders, reopening schools for in-person learning, and dropping mask mandates, sometimes months before the CDC considered it wise.
If you are trying to lock people down, I am standing in your way.
For Morris and his wife Brittany, that meant relief. What about if this gym were in New York?
Oh, forget it. I'd be done. I'd be washed out. We'd be finished.
And for Ron DeSantis, it meant reinvention as a national hero to some and a national target to others.
Governor DeSantis is just acting irresponsibly.
The highest hospitalization rate in the state of Florida at any point in the pandemic. And yet DeSantis has been fighting tooth and nail to stop any type of mandate.
So, more than 2 years later, a question. Who was right?
We were right and they were wrong, and millions of families in Florida are better for it.
Is Ron DeSantis right?
No.
Dr. David Agus is a CBS News medical contributor.
I can't say one right, one wrong, and that's part of the problem. It's not a binary black-white issue.
One study tried to compare all of it, taking into consideration the economy, education, and public health. A final report card, written in part by researchers from right-leaning organizations, did give Florida an A, while California and New York got failing grades. But another study in the journal Nature notes a problem. Weighing harms and benefits often comes down not to scientific calculations, but to value judgments.
Masks work in the right setting. Shutdowns work in the right setting. And that being said, in the wrong setting, they have very little role. And so you cannot be absolute about them.
Does Governor Ron DeSantis deserve credit for any part of his COVID policy that you've seen?
I think he did provide leadership, and I respect that part of it. I give him credit for that.
I think he caught a mood in Florida that worked very much to his advantage.
Dario Moreno is a political science professor at Florida International University. He says reopening in a state that practically runs on tourism and the service industry actually put DeSantis in a stronger position today than when he first campaigned on the coattails of Donald Trump.
Then Mr. Trump said, "You're fired."
He ran very much in the shadows of Trump, and this has really created his own image.
What is that image?
He stood up for freedom. He stood up for opening up.
Which is exactly how DeSantis now presents himself.
Florida will be the vanguard of freedom in this country.
An image that ignores a lot of heartache, according to his opponent, Charlie Crist.
Over 6 million of my fellow Floridians have gotten this pandemic. And we don't yet know the terms of, long COVID. So I don't think his record on this is sterling. I don't think it's admirable. I think it's appalling.
But what really matters to voters when it comes to COVID isn't facts and figures, says Moreno.
it's feelings.
This is a deeply emotional issue. If you lost your job, if you lost your house, if someone close to you died, all these things play into it. So we're not really voting on COVID, we're voting on our personal experience with COVID.
And for people like Eddie Morris, his experience points to just one conclusion.
How likely, from where you're sitting, is it that Governor DeSantis is going to win re-election?
For me, it's hands down.
Yeah.
A lot of people are saying that it seems hands down right now.
Yeah, I recently actually went to Florida and I talked to maybe 50 voters in 3 different parts of the state. This is for a piece that we haven't aired yet, and I found nothing but Ron DeSantis supporters. So in the state of Florida, from a political point of view, his moves on COVID are very, very popular. And it comes down to perception. In your household, do you care more about the economic effects or do you care more about the public health effects? If you care more about the economy and you weren't affected, luckily, by the other stuff, then you love what he did.
Yeah, I think the point about feelings being more important than facts and figures really resonates with a lot of people.
Yeah.
I get that.
If you are, as he said, somebody who lost somebody close to themselves, you have one way that you think about it. If you're somebody who had it and nothing happened
to you,
then you have another feeling about it.
Yeah, but see, lockdowns and shutdowns affect the whole state, whereas COVID fatalities affect only those households where they occur.
Yeah. But the shutdowns also work, too.
Well, so there's debate about the extent to which there was a benefit, and then this is where you get into the value judgment. And there's not a clean answer. You can't go to science and say, "Dear science, what is the answer?" And then you get one. It's all context and feeling.